Today we're going to talk about ALARMS. It's an acronym that we use to describe FASD characteristics, and it's based off of FASD Ontario. So with adaptation, that is like the ability to function daily, and it's often the biggest deficit. With that comes dysmaturity, and that's really somebody acting younger than their age. So they also have, those with FASD will have challenges with social boundaries, and understanding social cues, maintaining friendships, things like that. There's also difficulty with like judgment, so poor judgment, and like school, work, or at home. With transition, it's often hard too because it's just more overwhelming for them than it would be for somebody that doesn't have FASD. So maybe transitioning from grade school to high school, that type of thing. And with language, it's hard to understand and follow instructions. And the abstract language is also difficult. So examples like words such as soon, later, or perhaps. Those with FASD can also have trouble with they take things very literal. So we use the example of it's raining cats and dogs outside, and it's taken in a literal sense. And with attention, there's a lot of inability to kind of stay on task, to stay focused. It's hard to filter out stimuli. Those with FASD can appear like overstimulated, hyper or hypoactive, and often there's a lot of impulsivity. So doing and thinking, or doing and saying things that they haven't thought about ahead of time.
Reasoning, so especially with more abstract concepts. So our kids with FASD like really concise and concrete, something they can see. So some concepts like math, money, time, and ownership are more abstract. So those are some examples where they're going to have some struggles with it. Not that they can't learn these concepts with time, but it is going to be a struggle. Specifically with ownership, you might find some what we call like stealing behaviors, but their understanding of ownership is very different than our understanding. They may also have some difficulties with cause and effect. So for example, if maybe they had a fight with a sibling, they might not understand that the consequence is a timeout, right? And so timeouts, suspensions, anything that is like a consequence leading to, or like a previous behavior leading to a consequence, that might be really hard for them to understand. So it's more of modeling, it's about encouragement. Those are some strategies that would be a little bit more helpful than the consequence types of interventions. And then lastly, with reasoning, so coming up with a solution right on the spot, you might need to give them more time to come up with a solution, and understanding others' perspectives. So they may come off as not being very empathetic, but it's because it's abstract. So understanding somebody else's perspective is going to be really hard because, again, that's not a concrete example, that's an abstract example. Memory. So when we teach an instruction to a child with FASD, it might take multiple times to teach that instruction because one moment they will understand all the different instructions and how to do a life skill, such as like maybe tying their shoe. One moment they can do it, and then the next day it's all lost. And so we have to be patient, we have to reteach a skill as many times as possible. And then lastly, with sensory, so they might be hypersensitive or hyposensitive to various stimuli. So hypersensitive, they could be easily stressed out by lights that are around here. So maybe the lights in this room are too bright for them, so it's hard for them to focus. There might be too much sound going on, so they can't focus on the assignment that's right in front of them. Taste, smells might all be very sensitive. When they're hyposensitive, that means they're not feeling it as much. So hyposensitive, the most common ones are they don't feel pain as easily. They can't feel when it's too hot or when it's too cold or when they're hungry. So if they're upset for no reason at all, maybe just kind of check in and say, hey, are you hungry? Are you thirsty? And that, because they might not even recognize that they're feeling that way. And so that is alarms in a nutshell. And we hope that through this video you can understand when you're supporting a child or youth, whether that's in a school, in like a mental health environment, in a medical environment, that you can understand a little bit more about FASD and how you can identify FASD when a child or youth you're supporting.